floor is yours.
So, hello, afternoon. Just before I forget to mention, we are streaming this lecture live. So whatever you ask and everything, just consider that it's being transmitted. So just for you to let you know. Professor Aquilas is a very good friend from Brazil. He is from the University of São Paulo. He's an economist. He's written some books and many articles on political economy. So probably, and I hope that you will be able to link everything that we've been discussing over the module in terms of what happens in the real world. Yeah. So he will be exploring the case of Brazil, but you will link many of the theories that we've seen with his research. So I hope you enjoy. It's a real treat. Thanks a lot for coming all the way from Brazil, and please, the floor is yours.
Great. Thank you. Can you hear me?
Yeah.
I'll try to speak near the microphone, otherwise I can. For all of you here, thank you for Professor Elias Kondilis and Professor Jonathan Philippon for inviting me to this meeting. And I hope I can teach about Brazil, but also, as Jonathan has just mentioned, I think it will help you in order to concentrate in a specific case. But of course, Brazil is not apart from the whole world. So we'll be talking something related to the real world, to the real capitalist system. In fact, our contemporary capitalism that has been suffering huge, some economists called one of the hugest, let's say, crises in the whole history of capitalism, which is called a long depression. So, let's start. I'll try to make some points, and I'd like to cover these things like introduction, Brazil health system today, contemporary capitalism crisis, and of course I'll be talking about this in order to face the impact that the capitalist crisis is producing in our health system, an economic overview of Brazil during these times, and of course a crisis can face in different ways. I'll be concentrating in talking about the Brazilian health system underfunding, right? And it's a problem for all of us in Brazil, how we're going to face our new system, that it's only about 30 years that it's been taking place, this new system. I'll try to explain this. And I'll finish with some final remarks. I hope we can speak in 45 minutes, and then we can have about 15 or 10 minutes last in order to raise questions from the audience here. But I know that you have your seminars, and you'll be talking amongst yourselves with all these questions that I'll try to raise. Just to give you an idea of Brazil. Brazil is a federative republic that covers 8.5 million kilometers, or 47% of South American, let's say, South American region. We've got an estimated population 204 million in 2015, okay, according to the last records. The world's 5th most populous country, and also the political system is composed of several political parties. I would say 25 political parties, too much. And 3 levels of autonomous government: federal government, the central government, 27 states government, and 5,578 municipalities, local authorities. This is Brazil. I don't know if you've seen in the map, right? Latin American, but we are near the coast, okay, Atlantic Ocean, and there is a very specific historical point here to us Brazilians. We speak Portuguese, and the whole Latin American speak Spanish, right? And according to not only the language problem, but even that we are near the coast, Brazilian history has to do with, let's say, with a more outside atmosphere. We are facing Europe and United States. We do not consider ourselves Latins, which is something strange, right? It's weird, but it's part of our elite history in our country, right? So let's go. This is Brazil, okay. I don't know if you can see, but let's say in terms of population, the vast majority of population concentrates on the coast, right? And this is Sao Paulo, where I live, right? And the University of Sao Paulo is here, that is in the south of Brazil. So, but this is the Amazon. I think you've heard quite a lot about that, but the population concentrates in here. And the industrial development in Brazil that started in the 30s, in the 20th century, it started here in the south, right? And it went up here. So, of course, we are near the coast. We've got to say that we are facing outside Brazil. We are not very much interested in the development of internal economy in Brazil. That's a problem, yeah, that's a problem. But, let's see, this is just a map to show you. We can have here a line separating two Brazils. Let's say this is the health need index based on demographic, epidemiology, social, economic and geographical data, which is say, you know, the red ones is the poorest regions in terms of health needs, right? So we can cut here and say Brazil up to the north and Brazil in the south. So as far as we go to the south, okay, the most developed states. So that's why we say that we have two Brazils, right? Okay, in the 20th century, Brazil underwent rapid industrialization during a time of political turmoil. Just for you to have an idea, we've got several military takeovers coupled with authoritarian governments, right? With very brief periods of democratic rule. To be frank, we've been facing our longest period of democracy during the past 30 years. Let's say it started in 1985. At that time, I was in England. I was taking my master's degree in Lancaster University in the northwest of this country, right? At that time, we've opened up to democracy period in 1985. I was 25 years old, so now you know my age, right? 1985. So, but it's a very small democracy. And specifically in 1988, we had a new constitution, and that was created the new Brazilian health system in this constitution. So it's something very new. If we compare to England, for example, the NHS here was founded, as you all know, in 1948, and it's been facing some problems, but there's a long history. And health in this country is considered as a social right, a value. But in our country, a part that we have got in our constitution, but that I would say that the society does not consider health as a value, as a social right. It's written in the constitution, but that's nothing to do with considering as a social right, and this is a problem. I would say that's the biggest problem. I could end my talk here, right, and say, what are we going to do with this? So it's part of a political problem. It's not only an economic and any other kind big problem. I think it's the main argument. But let's move on, right? Health sector reform in Brazil, just after the 80s, in the end of 80s, was driven by civil society rather than by the government. There was a big sanitary reform movement in Brazil calling for a universal health system, right? It was not apart from the government, not from political parties. To be frank, there were some political parties that were involved in the sanitary reform movement. I would say that basically the Communist Party in Brazil, which was very strong at that time, it's not anymore, but it was that time, was very, and people from the Communist Party were fighting, were struggling for health to be considered a social right and a universal, right? So, and we managed to do this in our constitution, and then we established what we call unified health system, Sistema Único de Saúde, or Sistema Único de Salud. I don't know, are there any Spanish now here? No, doesn't matter, okay. So SUS, this is the name, SUS. It's a very nice name, SUS. Let's say succeeded, but it hasn't actually succeeded. SUS, instituted by 1980 Constitution, based on the principle of health as a citizen's right and a state's duty. Okay. Let me stop just for 1 minute here. I've got to say, but before that, a person, any citizen or not, let's say an individual, to have an access to the system, it had to have a work license. Otherwise, the hospital wouldn't accept to enter, to get access of those services, right? You have to have a work license. If you didn't have a work license, you could die in front of the hospital, then you have no attendance at all, right? So for us, for Brazilians, there was a big change, because now everybody from 1988, everybody has the access to health in Brazil, which is something very different. Although I'm going to show that it's universal health system, and there's lots of problems, right, to be universalized amongst the whole population, but everybody has the right to, okay, which is something very different, right? I'm quite sure that you were born in the 90s, most of you, right? No? So, but can you imagine, I was 28 years old in 1988, so that was the first time that I could have access to everything, okay, in terms of health. Let's move on then. Just to give you some slides about the health status, the health situation in Brazil. The prevalence of overweight, hello, you're not late, we've just started. The prevalence of overweight, it's very common in Brazil. People start coming out to the lecture just after, it's okay. The prevalence of overweight and obesity is increasing in Brazil. Let's give you a data here. 47.3% of men in state capitals report being overweight. Okay, about a third of families report they do not have enough food to eat. So Brazil, there's lots of contradictions, right, in our country. For example, diseases of circulatory system are the leading cause of death, followed by cancer and external causes, largely homicides and traffic accidents. Okay, basically in all those capitals on the coasts, okay, state capitals. Chronic diseases are the biggest contributor to the burden of disease and communicable diseases, although decreasing with time, yes, still affect a substantial proportion of the population. Let's talk about the Brazilian health system today, just for you to have a very brief idea, right? We are dividing in 3 subsectors, the whole Brazilian national health system. The public subsector, as I've already mentioned, SUS, remember the name, nickname, in which services are financed and provided by the state and federal, state and municipal levels. The private, for-profit and non-profit, let's say the philanthropic institutions, right, subsector, in which services are financed in various ways with public and or private funds. And the private health insurance subsector, with different forms of health plans, varying insurance premiums and tax subsidies. Is that right? Yeah, okay. So, but that's the situation of the whole population. A Brazilian population, as you remember the data I've already presented, 204 million in 2015. The public subsector accounts for 154 million people, million inhabitants. Okay, they haven't got any money to buy any kind of health insurance plans, okay, private plans. Now only 15 million has the access, not access, they can buy, okay, private health insurance subsectors. But something has to be mentioned here. But if a person who's got a private health plan, if you want to use, for example, the very, let's say the tertiary procedures like the hospital, like cancer therapies and things like that, the health plan will not cover because it's very expensive. So he's got to go to SUS, okay, the public sector, because SUS will cover, right? So my mom has died from cancer in 2010. She's got a lung cancer, right? And she, at that moment, she had a private insurance plan, right? It costed quite a fortune, okay, to pay monthly. And then, when she had to take a very specific and a very high medicine at that time, but the plan could not cover. He said, sorry, we are not going to cover. So my mom had to go through SUS. And we asked for SUS also, in other ways, to the public sector. And in 15 days, we had that specific drug that could help her in the last ends of her life at that time. Okay? So just for you to have an idea. So everybody uses SUS. Oh, this is just a small chart. Small to be just very generous to you. But just for you to have a very brief idea. We are a federative country. So SUS is organized with Minister of Health, state health authorities, we've got 27 in the whole country, and municipal health authorities. We've got 5,578 municipal health secretaries. And SUS works like this, okay? Everything starts from the bottom, as we call, okay? It's a decentralized system. So it starts from here, right? And everything is decided with the municipal health councils. And the health councils in Brazil, they are split in half of the municipal councils come people from, let's say, the users, all right? And half of the council belongs to the government, to the private providers, right? And state workers, right? So everything, the budget, everything, the new policies has to be decided in the municipal health councils, okay? Nothing can be decided without having the approval of this health council. And everything is approved here. And then if you join the municipalities, you're going to have health regions, right? We've got 432 regions, health regions in Brazil, right? And so the municipalities, the municipal health authorities, they sit together, they decide what you're going to have and the new policy, and they decide, they approve this, and then they go to the state health authority in a bipartite committee, which has the seat of a state health secretary and the, let's say, the ones who are in charge of the municipalities in that specific state. They sit here and they decide what they've decided on the bottom level, okay? Just approve. And then once it's approved here, and then it goes there to the tripartite commission. And here, there's a seat between the Minister of Health, the state's authority, and the local authority. Of course, there is a board of representatives. Okay? So the Minister of Health in Brazil does not have the power to decide any kind of policy by himself. He's got to decide amongst this committee here, which has got the representation from all the different parts of the system. So we used to say in the beginning of our system that the health sector has created a state reform. That was a bit, you see, because you cannot never a state reform in the whole apparatus just coming from the health sector. You've got to work with the whole apparatus of the state. But you know, people who work in health system, sometimes we are very, we think that we are the best. But we're not, okay? We've got to think of the whole state apparatus. But that's the idea for you to how the health system in Brazil works. Right, okay. So the Minister of Health formulates national health policies, but does not carry out provision. The states, 27, formulate their own health policies, coordinate and plan SUS at the state level, respecting federal regulations, because it only coordinates. State health authorities are responsible for medium high complexity health provision. And the municipalities are the main responsible for health provision at local level, especially primary care provision, right? So that's a kind of a system that has built up with an idea of decentralization, okay, with a decentralization health provision, and it starts from the municipalities. Let's go. Primary care, basically, primary care is in charge of the municipal level, right? With the decentralization process, we've created innovative programs. Notably, primary care in Brazil started what we call community health agencies program and the family health programs, right? This is basically, at the moment, we've got 45,000 family health programs around the whole country, okay? And then it is supported by the community health agencies from the communities. They are not elected, they are chosen, and people from the communities, they will be helping with these family health programs, right? We can criticize one thing here, and I've been working with this. That's why I separated from the mic. Actually, we've abandoned to think about a person as a worker. And we thought about the family health program that say what interests to SUS is the family territory, the family local territory. But that person just only live there, but it has to work because according to his work, he's going to have to take 3-hour buses to get to his work, okay? He's a worker, and people do not worry about this. So we haven't got any kind of health policies towards workers. We've thought about families. I can open this to discussion afterwards, but I think it's something that we've got to face. It's a problem, okay? Because anyway, let's move on, and I can answer this in our 15 last minutes. Okay, second care provision is problematic here because service supply is restricted and often given preferentially to individuals with private health plans. Second care has little regulation, medium complexity procedures are often neglected in favor of high cost ones. For example, SUS is highly dependent on contracts with private sector outsourcing, especially for diagnostics and therapy support services. Only 24.1% of CT scanners and 13.4% of MRI scanners in Brazil are public, and access is patchy. Tertiary and hospital care includes some high-cost procedures which are done predominantly by contracted private sector providers and public teaching hospitals. Right, we've got lots of university hospitals in Brazil, and they belong to the state, to state authorities, basically, right? And are paid for the SUS and about market value. Right. But let's move on to our underfunding problem in Brazil, and I think it's one of our biggest problems according to the crisis that we are facing and we've been facing from the last 30 years. So let's say, financing is one of the most discussed and problematic issue in the last 30 years. Let's say 30 years, let's say SUS age. And of course, at the same time, with the capitalism crisis that is becoming worse and worse, right? I'll be talking about this. So problems, we're still facing lack of financial resources, which goes to low public health expenditure. I'm going to show you some figures. Public financial sources have not well been defined in our country. Let's say we've got 30 years of implementing SUS, the public service, but we still haven't actually defined even our constitution, right? So that's a problem. We've got a lack of commitment of resilient state. When you talk about resilient state, which is a federative state, so basically the lack of commitment belongs to federal, the central government, and the state level, because the municipal levels, they were the ones who have actually allocated much more resources according to their own, let's say, own revenues, right? So the problem let's say, locates on federal and state level. Large sums of public financial resources have been transferred to private sector outsourcing. Big problem. Public expenditure, now two, let's say, curiosities here. Public expenditure financed by an outdated tax system. Why an outdated tax system? Because I would say that the basically main tax that support our health system are applied to productive capital, which means, let's say, tax on corporates, industries like this, okay? They are not applied to the dynamic of our contemporary capitalism, which is dominated by the financial capital. Let's say many of the tax that support health system, okay, are towards corporates, not towards, let's say, banks, okay, pension funds, let's say, all the money that circulates amongst the financial sphere, right? So we've got to think about this, because basically, I'm going to show you some figures, that one of the problems of the capitalist world nowadays is that the productive capital is diminishing, the rate of profit of the productive capital is falling down, right? And the financial capital is increasing, is dominating the control of capitalism today. So we've got to think about how to change the main sources of our health system. In Brazil, we've got to think about different tax or tax reform concentrated on financial capital. Not only in Brazil, even the whole country, it's all around the world. And there's another curiosity here, the last one. Public expenditure financed by a regressive tax system in Brazil, basically based on indirect tax. Let's say sales taxes account for 45% of the total tax revenue in the country, okay? So that's a problem. Okay, let's move to contemporary capitalist crisis. Of course I want to mention this because there is a great impact on our system, but not only on health policies. I would say in all social policies around our country. What is the essence of contemporary capitalist crisis? Okay, I won't talk about this too much. As an economist, I could speak about 45 minutes about this, and I'll be very enthusiastic. But I'll just try to show just 2 slides for you to have an idea what this impacts our system, and I'll take just the problem of underfunding, right? I could take any other problems. But let's say, what's the essence of contemporary capitalist crisis? I would concentrate on 2 trends. Long period of the fall in the rate of profit, basically in productive capital, right? Let's say incorporate capital, production. And also, what is the productive capital is trying to face the problem of the fall of the rate of profit, so it escapes and goes to the financial sphere, and according to the literature, it's increasing what is called financialization. It's quite a difficult word to mention, but financialization means dominance of interest-bearing capital, according to one of our bigger thinkers called Karl Marx. I don't know if you've heard about this. Okay, from chapter 30 onwards, in the 3rd volume of Capital, he was discussing this. Okay, the problem of the interest-bearing capital and its perverse form nowadays, which is called fictitious capital, like the increasing of pension funds, the increasing of all, not only the bank, but any kind of financial institutions, which they're not only banks, okay, all that you know, okay? So that's the way that the capital faces, the productive capital faces the problem of the fall of the rate of profit. So they step from there, to the other sphere. But not only this, when you talk about capital, you talk about a social relation, right? Between the controllers of the means of production, and also the workforce, the workers, right? Okay, that sell the work. What is productive capital is going to do facing the fall of the rate of profit? It's going to smash the workers, it's going to smash the social rights. And as you've already heard here, the period of the neoliberal times, okay? Neoliberal times. So, I've explained this because look at the rate of profit line here from 1947. Let's take an example, North American corporations, okay? Oh, it's going down, right? Basically after the Second World War, okay? It's going down, right? But when we come to the 80s, the line here tries to recover a bit, but not compared to the past. And this recovery has to do with what? With the neoliberal times. But basically, Brazil is creating its Brazilian health system here in 1988. So very different from when National Health Services was created here in this country, right? In those times that basically the vast majority of the capitalist, let's say the most advanced capitalist countries, like England for example, they were having much money because that was a different phase of capitalism when you compare the whole history of capitalism, right? But here, this phase has to do with crisis, has to do with the problem of financialization, and we are trying to build a universal health system with these constraints. Constraints because we are dealing with a different phase of capitalism. This is very important because we are trying to build up towards a universal health system in a very different phase of capitalism, which there is a structural constraint against us. Okay, let's move on. Let me see how much. Okay, 25 minutes. That's the rate of profit in Brazil. Basically, from 2007 up to the moment, the rate of profit is falling down. So, of course, I'm going to show you some graphs and tables that's going to explain why we are talking and we are facing SUS underfunding. The Brazilian National Health underfunding has to do with this problem as well. But let's face in your mind, let's bear in mind that this is very important. We are talking about different phases in capitalism. So, from 1980 to 2013, if we compare these, just for you to have an idea, what I'm going to show to this with this table, I'm going to show to you that there is the dominance of the financial capital over productive capital, over corporate capital, right? So have a look at this. According to IMF or McKinsey Global Institute, from the 1980 to 2013, global financial assets in terms of dollars, $1 trillion, a huge amount of money, has increased 2,275%. If you compare to the gross national product, I'm going to explain, productive capital, let's say corporate capital, has increased only 525. So I think this table shows to you the dominance of the financial capital. So this is capitalism nowadays. Let me introduce to you. Right. Okay. That's why when you talk in terms of social policies along the whole world, even in Europe, you've been facing the austerity measures from all countries. But it has to do with this situation. That's capitalism now, and let's say capitalism controlled by the interest-bearing capital according to Marx, right? And interest-bearing capital is not interested in health as a social right. Sorry, okay? In Brazil, we are trying to build this. So population has, the citizens in Brazil, they hasn't had any specific time to understand what a social right means, because we've got to face with this contradiction, right? And the interest-bearing capital is trying to, let's say, sorry for the expression, my English is not that very good, right? But the interest-bearing capital is trying to bite the public budget in order for its benefit, but not in order to have a universal health system, any kind of social rights in Brazil. So let's have a look at some very quick, up-to-date economic Brazilian economic overview. GDP growth rate from 2014, that the crisis faced us very much. Sorry, we are Latin, so we speak like Portuguese with hands. I'm terribly sorry. I was supposed to be like this. 2014 to up to 2016. That's the situation in Brazil, right? Brazil has the highest public debt ratio among emerging economies. It's incredible. How am I claim for more funding, for more public health funding in this situation? That's what I'm trying to explain to you, right? Because we've got to face this problem. I think this is the most important problem, right? Discretionary spending. Let me translate this to you, right? In terms of GDP, relation to GDP has gone down. When we call discretionary spending, has to do with health, education, transport, does not include interest payment. If we look at the federal budget, right, or central government budget, they pay quite a lot to interest and to our debt, right? So discretionary spending is a very technical word which concentrates just like health, education, and transport, right? Public transport. Let's say it accounts for 3.9% of the GDP. It's very low. It's very low, right? Brazil, yes, we won the
trophy.
Yeah, the trophy. Brazil has the highest interest cost on debt in the world, right? Interest cost to GDP. Let's have a look at here. There's the blue line. The green one is Latin American, and the red ones refers to the European countries. Let's say the peripheral countries in Europe, right? Not England, not France, but the peripheral. Okay? Okay, so that's the situation. How much does Brazil lose in potential fiscal revenues? That's a strange, it might sound to you a strange question or weird, but for us it's very important. Let me try to explain this. How much does Brazil lose in potential fiscal revenues? In other words, apart from the price, okay, because let's say the revenues, the federal revenues are going down, okay, just as an impact of the prices. But apart from that, we could think about some reforms, tax reforms. Crisis has opened up to cuts on primary public expenditure. Has not been discussed the review, mistake here, review of tax fiscal policy in the sense of tax equity, progressive taxes. Contradictions. That in 1995 there was a president called Fernando Henrique Cardoso. He's very well known in part of the world. I remember when I was my first time here, because Cardoso has lived in England for some time, and I was in Oxford, and I was talking there, and people say, you come from Brazil, so we've got a very close friend, Mr. Cardoso. Cardoso, who used to be our president, right? And Cardoso has studied in Oxford and also has taught in Oxford, and he started in the 90s, belonging to lots of presidents that we've had in this period of democratic period, right? But they are much more close, like to Tony Blair or to any, let's say, in a very neoliberal way of thinking about his policies. Right? And in 1995, in his period, look at this, exemption of profits and dividends. Let me try to explain. It's the exemption from income tax. Let's say multinational companies do not pay tax in Brazil. They could send their profits directly without paying any tax. So if I think about a new source for health system in Brazil, why do not prohibit these people, to send their profits without paying any tax? We've got to think about this. in 1995, even in this government, Fernando Henrique Cardoso, institutional interest on equity. Let me explain this. Let's think, a corporate company, before paying, let's say, before paying their taxes, they can pay for the financial investor their interests before, and then the tax will be charged. Do you understand what I'm trying to explain? So we've got to finish with this, because let's read. This occurs when a company borrows funds from its shareholders or members from its regular activities, but in return it pays them before, with interest before the payment of corporate income taxes, right? So that's the power of financial capital, right? The interest-bearing capital. Okay. This is very interesting here. Lost revenue was 150 billion pounds in 2016, nearly 4 times the pension cuts planned by the current government. Let's say Brazil has got let's say potential in terms of fiscal revenues, 60 billion each year, right? If we could, let's say, do some more of those reforms, okay, because we are losing money, okay, because of those measures, right? This capital formation, not the financial capital, is going down. Brazil real average monthly income, but it's only increased here because we export. We are considered primary commodity countries, right? We export soya. Soya, can you translate? Yeah, soya. 80% of our exportations are concentrated with soya. Okay, we do not produce high technology in Brazil, right? So when the price of commodities go or recover in the whole country, we go a bit better. But if it goes down, just after 2014, that went down, right? The price of commodities, and then our situation, because we haven't actually built or we haven't got any kind of industrial plan in Brazil, right? So that's the situation. Okay, let's move on to our underfunding. Okay, but you might ask me, but what is the SUS funding or SUS financing in Brazil? But before talking about SUS, in 1988 Constitution, the best question is not how is financed the health public system. The best question will be how is financed social security system, because we've invented in 1988 Constitution social security, which includes pension funds, social care and health. And we've built a specific social security budget, because beforehand health has to struggle for some money with, let's say, any other sector, because we didn't have a separate budget. Okay, so from 1988 Constitution we invented a separate, which is called social security budget, and it's financed by taxes and social contributions, right? Let's say, and health here, let's say 89, almost 90% accounts, social contribution accounts for financing health, and only 5.8% from taxes. Taxes from the central government, state government, and municipal local authorities, okay? Right? And others 4.4, just for you to have an idea. So, when we go and think about social contributions, let's show to you. Social security contribution, employee and employer, okay? But in 1993, has changed. There was a constitutional amendment that this source became exclusive to pension funds. And the health sector said, oh, what are we gonna do? Because this is the majority amount of money that supports social security, and now it goes exclusive to pension funds. So that was the first step. The social security budget had to face, and health had to face with this problem here. And so social contribution to social security financing, let's say billing, corporates, okay, to health 47%. social contribution, net income 27% with health. From this time on, we didn't have any kind of earmarked source to health, and that was a problem that we had to face from all these years. Let's say in the last 30 years, we've been facing to earmarked sources. Very, very brief. SUS financing history here, okay? 1982 Constitution, unstable funding. We've got a social security budget, but we didn't have any kind of earmarked to health, right? Only in 2000, a constitutional amendment that earmarked to health based on GDP, right? The variation of GDP amongst the years, right? But that's a problem in Brazil, because to reckon GDP in Brazil, we take about 1.5 years. So we've got to face with estimations, and the central government had a problem with these. So that was a problem for health. And we've fought quite a lot. We've fought in those years to have a earmark, to change this, and then it came the law in 2012 and didn't change anything. There was a new law to do this, and in fact the law didn't change anything. Only in 2016 we've changed the earmark, not based on GDP, but based on net current revenue by the central government. But in the last month of the year, let's say in December, we had a new constitutional amendment that we had freezing of expenditure. What happened? Happened that now any kind of public expenditure is freezed up to in the next 20 years. Because of the crisis, anything will be increase. So that's the situation of the underfunding of health in our country. This graph is very interesting, because if we talk in terms of only the Minister of Health expenditure in relation to GDP, look at this line, 1.7%. Hasn't changed all these years. Talk in terms of the Minister of Health. Remember that SUS, the public health system, we've got to consider the state level and also the municipal level. But we are just facing here the Minister of Health, only 1.7% in relation to GDP. But compare with this, with the red blocks here. Look at 2015, 8.5% in terms of debt interests. So the federal government had to pay debt interests, okay? So how can you actually have health as a social right and even a main policy, according to this situation, right? It's incredible. And look at the general budget of central government in 2015. Let's move on. General budget of central government accounts for 567 billion pounds, okay? The general government, the federal government. But look at this, 42% paid to interest payment and debt refunding, okay? So 42%, right? So the interest-bearing capital is interested in, let me try to give you these words. I think that explains what I'm furious with all these, angry, okay? He's biting the federal budget, right? But he's not happy with only 42. He's trying now to bite another slice of this pizza here. Pension funds accounts for 23% of the general fund. And now we're having a big debate in Brazil. In fact, today is the 6th. Yesterday there was a general strike in Brazil against the pension funds reform, that the government wants to reform the pension funds. But why so interested in reforming the pension funds? That's another austerity measure, but it has to do with the financial capital, because he's interested in biting these slices. So it's very important to, let's say, privatize pension funds, right? And then Brazilians have to pay. Let's say go to a very important bank in Brazil and try to make it private, right? So that's why they are trying to pass through Congress a new pension reform. So can you see how here it's very slow. It's only 4% of the general. Okay, all right. So public health expenditure of 3 levels of government. Federal government, it was in charge, let's say 100%. In the 80s, the federal government was in charge of 75%. Let's move on only to health public expenditure, right? So let's say federal government was in charge of 75, municipal governments, local authorities, only 7%. But with our process of decentralization, that the municipal level were trying to allocate more money, and the state levels as well, and the central government was diminishing its part, right? So as you can see here, go to 2015, nowadays, so the federal government, the central government is in charge of 43% of the whole public expenditure, states 25 and municipal 30. Look at the municipal level has increased quite a lot, okay? That's the process of decentralization. But the problem is that we have decentralized responsibilities, but our tax system has not been, in fact, decentralized. That's the problem. We've got to face this. Okay. But this is interesting as well, because it shows you total health expenditure in Brazil, public and private. 2014, it accounts for 8.1% of GDP. PIB is in Portuguese. Sorry, I didn't have much time. Okay. 81% in relation to GDP. Okay? Is that high? Is that low? If we compare to other countries, okay, you'd say that England spends about 8% in relation to GDP, but only public. But let's look at this chart. So look at this, 81%. The public one, this part, central government, states, municipalities, accounts for 3.9% of GDP. And the private, here, accounts for 4.2% of GDP. So that's what we call, I don't know if you got the name in Portuguese, in English, we say that Brazil is a kind of an ornithorync animal. You know that animal that is very strange. A small one with 30 centimeters in length. It's got a dark... huh? That's it. Sorry, I can't pronounce. Anyway, why I'm talking about this? Because we've got a universal health system in law, but the majority of the expenditure comes from the private, right? So 4.2% GDP, and the public 3.9%. Okay, can you understand? When you talk in terms of public, central, federal, municipalities, when you talk in terms of private, we are referring to health insurance, and the other two are out of pocket, right? Out of pocket, but the majority of the out of pocket account for pharmaceuticals, okay? And this one for other out of pocket, like if I go and pay for a physiotherapist, okay, by myself, okay, it's here. So that's a problem. That's a big problem in Brazil. But it concentrates here. Public, 3.9% of GDP. Comparing to other universal health systems in the world, 3.9% Brazil, only public. But all these countries, let's say an average of 8% of GDP, but they are public. Cuba, France, Germany, Spain, Sweden, and United Kingdom. So, even that, let's say, apart from we have developed quite a lot in terms of increasing public expenditure. But when you compare to other countries, there's something very specific. Okay. Central government public expenditure. Have a look at this. 30 years of SUS trying to be implemented, and we haven't changed this kind of health model because it concentrates on hospital care, not in primary care. It accounts for almost 50% of the whole budget, and primary care 8%. According to our guidelines, to our SUS guidelines, we wanted to invert this, to spend much more in primary care than hospital. But that's an issue that we will talk about. Okay. Remember that I've mentioned that we're going to face in the next 20 years what I've written down here. I don't know if it's a very good translation, but I've written a book. I've read a very important book by Jack London, an American Marxist, and he's got his book called Iron Hill. And I would say Iron Hill on social rights in our country. Right? Why? Because Constitutional Amendment 1995, as I've already mentioned, established a cap for primary expenditures, health, education, okay, not including interest and other financial expenses for the next 20 years. And it's going to only increase by the inflation index, but it's very, very low. So can you imagine what would be the situation in Brazil? Who studies migration here? Okay, I think I'm going to migrate to England because the problem there would be quite difficult. Oh, okay, this is only a graph to show you that the federal government from 2002 up to 2015, I've already mentioned that it was spending 1.7% in terms of GDP. Remember that? But if this amendment had been implemented before, this expenditure should have gone down, right? And if you want to estimate or a kind of projection for the next years, let's say, from 2017 to 2036, the projected loss will be 100 billion pounds to our health public system. That's the situation we are facing. Let's say, in terms of population by age in Brazil, right, let's say more than 60 years, 2016, accounts for 12% of the whole population. In 20 years ahead, this population, more than 60 years, we account for 21%, let's say, but we are not going to increase any kind of public expenditure. So, how are we going to face? And what about the health technology? Then we all know that in health systems, technology is something that it doesn't stop and increase quite a lot. What are we going to face this? Okay. Another point I want to make to you, that Social Security budget, remember our Social Security budget loses quite a lot of money because with a constitutional amendment in 1994, it started from the central government, withdrawn 30% of the total revenue from the Social Security budget every year. Why? In what purpose? In order to extract from the Social Security budget, in order to the central government to have it free to pay interest debt. That's according to the economic policy in our country, right? And that started in 1994. It hasn't stopped up to the moment. Let's say each year the Social Security budget has had surplus of 20 billion pounds. But what for? Because 30% is extracted, is taken by the central government in order to pay interest rates. So these had an impact from 1995 to 2015, a loss of Social Security resources about 192 billion. So we've got to change this situation as well. Another point, public resources granted to private health. I'm almost finishing. But that's a problem. Because look at this. I can show you this table. In 1993 to 2014, public expenditure in terms of GDP. It has increased, but not as much as has increased private expenditure in terms of GDP. Just to show you that we've got a universal health system, that the private expenditure has increased quite a lot in times of a different phase of capitalism, controlled by the financial capitalism, of course. So we've got to face all these situations. That's a problem for us. Another question I want to pose here, not a problem. Fiscal waiver, it's increasing in Brazil. When you talk in terms of the central government general budget, fiscal waiver in our budget this year accounts for 633 billion pounds. The central government total budget accounts for 850 billion pounds. So it's quite big, fiscal waivers. And if you look at this graph, health accounts for the third place of fiscal, 13%, 8 billion. Let's try to give you the idea here. If now we have the public expenditure was freezed for the next 20 years, so the financial capital and let's say pharmaceutical industries, they're very worried about this, okay? Because they sell products and lots of things to the public system. So, but if the public system has its expenditures freezed, so the corporations are trying to force the government to open more and more fiscal waivers for them, right? And it's going to increase these. I know the next budget for 2018, and the idea is that health has become the second area that has got more fiscal waivers than anything else. So there's a problem. We've got to stop with this, of course, but the capital does not want to, right? So I'll be finishing now. So what are the challenges? Quite a lot, but I'm not sad. I'm very enthusiastic because I've come all the way from Brazil to here, and I think it's very important for myself to be with all of you from global health courses, because I have to speak with the whole world, because it's not a fight and a struggle only in Brazil. I've got to tell everybody that we've got to change our orthodox macroeconomic policies maintained since the 1995, which have increased the austerity measures with this macroeconomic tripod. We've got to change this. We've got to limit the interest payment on debt, strengthen the debt auditing struggle in Brazil. There's a big movement in Brazil, okay? But Professor Aquilas, aren't you a bit reformist? Because you think that you can, yeah, but we've got to pose the struggle, okay? Of course I know the financial capital is just laughing to me and saying, poor Professor Aquilas, he believes that we're going to have an auditing, debt auditing in Brazil, but it doesn't fucking matter, sorry. I know that I can't say this, but I'm a president. So, yeah, because we've got to pose the problem, we've got to pose the questions, to organize our struggle there. Review the fiscal waiver, of course. Review the tax policy, review the tax policy towards a progressive approach. We've got to talk about this. Ban the Constitutional Amendment 1995 that established a loss of resources that I've shown to you, around £100 billion. We've got to ban this, okay? And we've got to go to a general strike for this. We've got to adopt a financial transaction tax. That's another big issue. I've got a PhD student here. He's come all the way to spend 3 weeks here with Professor Elias and Professor Jonathan, and he did his master dissertation on this problem, on this issue, and he studied here in Europe. 10 countries have decided in European Parliament to adopt financial transaction tax. But the problem is not all, they've decided, but then the next step was to regulate this. And IMF and IHPEH bank did not permit up to the moment to regulate this. But we've got to pose this question, right? Here in Brazil, look at this in Brazil. It's incredible. For example, in Brazil, there are some studies that, for example, for the ones who earn more than £625,000 a month, we've got people in Brazil, we've got the capitalists, part of the capitalists, who earn this. So there is a study that is trying to think about how to establish a financial transaction tax. People who stock their money in the banks, okay? They receive like this, okay? But had to be linked have this new financial transaction tax has to be linked to social security budget. Otherwise, the state apparatus will concentrate to pay interest debts. So we've got to do something related here, right? And directing 50% to health. To create a tax on big fortunes. I think you've heard about this, wealthy tax, okay? It's very well known in Brazil. We have a debate on this as well. We've got some projects that are going through the Congress, but they are going through. Right, okay. The problem is to get it approved. To adopt a tax for remittance, very important, of profits and dividends made by multinational companies, as I've showed to you in the last slides. But my last slide will be this. Ultimately, to overcome the challenges that Brazil's health system faces, a revised financial structure and a thorough reassessment of public-private relations is needed. Therefore, the greatest challenge facing the SUS is political. Such issues as financing, composition of the public-private mix, and the persistent inequalities cannot be solved in the technical sphere only. It's a political problem. That's why I've come all the way here, and thanks for you to listen to all these slides. Thank you very much.
So, we are by far out of time. We will release you, but I think that we could take 2 or 3 questions. We'll start our seminars with a quarter delay. So, do you have any comment or concern?
Too much information.
Yes.
Thank you very much. I really enjoyed that. Just to take you up on the last point you made, that the problem is political ultimately, but a lot of the things that you suggested at the end are more sort of economic suggestions. So what would be then the political solution to this political problem that would accompany the other challenges that you discussed? And secondly, I was also interested to see that the whole issue of the regional disparities, that despite the municipalities having increased their share of contribution to the tax, the overall taxation system hasn't changed on a regional basis. And at the same time, you know, from the little I understand about Brazil, there are quite huge regional inequalities in terms of social and other kind of conditions, with the north and northeast being more badly affected than the south and the southeast. So I'm wondering how, you know, what is the sense, aside from people having to migrate more and longer distances to like find work, aside from that being a solution, how would all of this have a bearing on the regional disparities? Like, you know, even if all this succeeds, would that solve the regional issue, especially in light of the fact that the taxation system is even more unfair to those regions that are suffering more?
Okay.
I think we can cover these questions.
Yeah, I'll start from the second one, and then I think it relates to the political one. The second one, I think I'm sure, let me find it here very quick. I'll show this map, and you mentioned this. Sorry. In the beginning. Right here. Okay. I think you were trying to mention this, right? According to our last study, of course, that's the north and northwest, okay? And they've got the bigger health needs, right? So I haven't actually mentioned in my last proposals something related to this, but we've been working on this study because not only talking about enough money to health, to public health, but we've got to think about an internal distribution of the money within the country. So we've been working with something, let's say, an equity resource allocation with the people from the Ministry of Health and also with the local authorities and the state authorities. We've got to change that in Brazil. right? To be frank, that's something that we are trying to do for next years with people here from this university, with Professor Elias and Professor Jonathan. We've been trying to think about facing some example of the ROP allocation here in ROP. Raw allocation here, resource workers party allocation here in England that is starting in the 80s, thinking about how to distribute the Minister of Health money to the municipalities and even to the state governments, considering health needs. And that's the big question, what is a health need? Right? And so we've started studying this, and we want to go on researching on this specific aspect. And we think we can do some kind of conversation here with this university, with these two professors here. And in order to reckon, as we've already started something like this. So that has to have a change, not only in terms of talking in terms of the whole financial resources to municipalities, but how the money from the Minister of Health is going to be distributed to the state levels and to local authorities, considering health needs, because there is quite difference between two Brazils, as you mentioned. So we've got to think about this. I haven't actually mentioned in my last proposals because I was trying to concentrate more on a structural problem and structural point, but I think it's quite important, right? So we've got to go on with our researches and think of all those economic aspects that I've mentioned, and I think we've got to work on that, and I think they give us such more support to organize our struggle.
The argument.
Yes, and to have more strong arguments in order to organize our struggle. But I all know that I've been working with this for quite a long time. I've written several reports on this. Okay, I've handed to Minister of Health, and they all become, you know, good reports in the last room of on the third floor in a special drawer, and nobody reads, right? So I think we've got to organize more our struggle. Let's see, not only with political parties, but with any kind of movements, but I think political parties is important. So there's a big debate in Brazil nowadays, because people who work like you, because we've got in my university, we have a PhD, global health PhD, we have a PhD on global health. And students there, they study quite a lot, just like you, yeah? But they do not have much connections with the, social movements, unions, political parties. And now we're trying to change part of our curriculum in order to talk with our students, in order to look at the whole world and to the real world and try to organize themselves. And it's part of our program in order to study some critical thought, in order to study this. Otherwise, you'll be just looking to health as a field to study, but as I've tried to explain, it's very important to organize our struggle, our political struggle, because otherwise we'll be doing some researches. So we've been facing this problem, and I can tell you that we are not very organized in Brazil at the moment, and we've had not a military coup d'etat, but we've just had an institutional coup d'etat in 2016. Institutional coup d'etat. I've got to have another talk to explain. I'll be finishing here. But anyway, it's very complicated. But I don't know if I've answered your question.
Any other questions? People that presented about Brazil, yeah? You had some people.
Thank you, Professor, for such a worthwhile presentation. Like Jonathan mentioned, I studied Brazil because I was preparing a presentation for that, and now I'm writing on that as well, so I'm more interested. I have heard there's a big social protection program by name of Bolsa Familia, I guess, in Brazil, and there is a social health protection component to that for offsetting the catastrophic health expenditure effect on poorest of the poor. So I was interested to know from where the expenditure for that aspect is coming from, main health budget or the social security budget you are talking about which is under a crisis in Brazil. So, and what are the impacts? Because it's a big program, and I've started the nutrition and health is a major component. So in that way, you are mobilizing the demand for healthcare. So, but I couldn't grasp how much that program, the social health protection, has imparted on the whole health outcomes of Brazil, or wasn't it a factor or whatever?
I think she's asking about the impact of Bolsa Familia in health outcomes, and also where the money comes from for Bolsa Familia. Yeah.
Does everybody knows what Bolsa Familia?
Do you guys know what is that?
It's a kind of a cash transferred to the poorest people in Brazil, the poorest families, that has been invented in, it was created in 2006 during Lula's government in Brazil.
It's a cash transference program.
Yes, a
So
cash
if you
transfer
are,
program.
Below the poverty line, you are you can receive this money.
That is in charge. That accounts for 3 billion pounds. 3 billion overall in the whole. Yeah, and it is in charge of 50. Let's say 20,000 families. We've got in Brazil about 70 families. Families consider four people in a family. Just a very general idea. And but Bolsa Familia, this special cash transfer, accounts only for 0.3% of GDP. And health, as I've explained, Minister of Health Expenditure accounts for 1.7%. So it's very small amount of the total general. Okay, it's a very important program, right? But it's not a social right. If tomorrow a new president wants to finish this program, he could. And health, as I've already explained, is a social right. It's in our constitution. If you don't want to follow this, you've got to write down a new constitution. Okay, so something that we actually, for us Brazilians, is very important, right? But we are fighting for Bolsa Familia to become a social right. Let's say for everybody. Like here in Europe, especially in France, you have an income cash transfer for everybody. It does not depend if you work or not, okay? But you can receive this from the government. We are thinking in fighting for this, right? Anyway. Yes, please.
I have a question about the political affiliations of the municipal health authorities. So whether the municipal health authorities are politically motivated in any sense, and if they are, then how do their political motivations affect their budgeting priorities, or how they spend money, or what sort of policy they want to put on the agenda?
Let me try to explain. I don't know if I got exactly your question, but let's say the municipal local authority is indicated by the mayor, right? The mayor is elected in Brazil, right? So he comes from a political party, and he indicates a man. He could indicate you coming to Brazil and say, he could be. He studied global health in England, so he could be a local health authority, right? So, but as we've planned our health public system, that everything does not have to do directly to political parties. Let's say you're going to get your money. You've got a special budget for health, right? So, and even if the state level or even if the Minister of Health does not belong to the same party of your mayor, that doesn't not mean that you're not going to get money from them. No, because we've got block transfers direct, okay, from the Minister of Health, which has to do with let's say health health procedures, nothing to do with some kind of political interests. I don't know if I got the question. Is that? So the local, to finish this, the local health authorities got a lot of power if he wants to. But sometimes, basically, the mayor indicates his nephew to be, and that's part of our political culture in Brazil, and then that's a problem, right? Some of them, anyway.
It's just that some of the indications are non-technical indications, and they are political indications. So, and it's true, if you work at the local level, you feel a huge oscillation between each election. You never know exactly what will come up. Yeah, the technicians state they are usually working for the municipal level, but who is the boss will actually change every election, and this can become a problem. It depends a lot on where
Just
you
to
are.
give you an example, last year we had the municipal elections, right? And 85% of the local health authorities changed. So the new ones. I've been giving a courses to help people to help local authorities since in 1991. Okay, how SUS works, and then when they learn, they leave.
Yes.
So I'd like to ask, first I'm Brazilian.
Oh,
so,
yeah. Where are you from?
Rio.
Rio. Oh,
Yes.
that's good.
And well, I'd like to ask two things. The first is related to our internal debt that you talked. I
Yeah.
observed in one of the slides that it's increasing.
Yeah.
And it's important to say that we had, of course, we had a more new liberal party during Fernando, but we had almost 50 years of a works party in Brazil, which is very strong left wing, and with all these problems is still occurring. So would like to ask you first, you attribute this internal debt to what? I know it's lots of things, but most importantly, to what reason? And secondly, I would like to go back to, sorry, such a question, because I think in Brazil, really the problem is political, and that's why I emphasize we had two parties with two different ideological perspectives, and they couldn't solve the problem. So my next question related to the first is, how do you really think we can tackle this problem, observing that I think independently of the ideological wing and political view, we are not solving our real problems inside Brazil.
That's a big question. But very interesting. Very interesting. I'll just put this graph again, and I'll answer. Yeah. So according to what we've mentioned, that in the 1995 we had a liberal president, Fernando Cardoso, right? And you said, which is true, that after 2003 we had the Workers' Party got into power and Lula was elected president. But no changes in terms of economic policies. In terms of economic policy. Because this graph shows this. Because health, this is the Minister of Health expenditure in relation to GDP. It hasn't actually changed. So, in terms of health considered as a priority in our country, hasn't been changed in terms of allocation money. When you look at the Minister of Health, no change through the liberal period, and even when the Workers' Party got into power, no change at all, no change. Okay. So, I think I can answer you part of the question. So, let me just finish saying that, of course, which is much more complicated, right? Because we had the Workers' Party that brought into power. But the Workers' Party in Brazil is something similar to the Labour Party here in England, which is a left-wing, okay? Tony Blair, times, okay, I think you all know. Okay, and the same happened in Brazil, right? Lula, I think you've heard, he was the president. He's the founder of the Workers' Party. He's a worker from one of our industry parts in Brazil, in São Paulo, as you know, right? But there is a very particular history in Brazil, political history, that the unions in Brazil, they did not fight for a universal health system. According to their history, they've been fighting for a specific private health insurance plan, even from the beginning, right? So Lula when he got into power, he was not interested in, allocate more money to SUS, because he thought that the best way for Brazilians is to buy, specifically, health private insurance. And we have something that is very particular in Brazil. When you're going to present your tax system, right?
Your tax return.
Income.
Your tax return.
Yeah, tax return. If you have a health insurance plan, you can discount from what you're going to pay. So basically, last year I was in a meeting in Rio, okay, with the Frente Nacional contra a Privatização da Saúde, which is something similar to keep our NHS public here in this country, right? I was in a meeting with these people there, right, fighting against privatization in Brazil, right? And then I was the one who was trying to defend that we have to stop having a kind of a liberation for people to pay less tax if they've got a private insurance plan, right? And then a man came from the floor, okay, a worker, he belonged to a union in Brazil, and he said, the professor is a bit radical. Why does he want to finish with this? Okay, because how can I go back to my union and say, people, please, let's unionize, because it's a very big problem in the whole world, as you know, okay? People are not trying to go to the unions to defend their own interests. They do not want to, okay, be a member of the union, right? And how do I convince people to be a member of this union if I don't have anything to offer? And one of my big offer is, please, affiliate here, because you're going to get a private insurance, okay? So I cannot defend this. Sorry, Professor, you're a bit radical. This man was from one of the left-wing unions in Brazil. They belongs to a party called PSTU, the Unified Workers Socialist Party in this country, and belong to a union which is very leftist. So we've got a contradiction in our country. Even part of the working class is much more interested in buying health. Huh? Because we are living under, and now I'll finish, with the other neoliberal times. We've been facing this, and there's a book that was printed, that came out in Brazil last year by two Marxist French philosophers, Philippe Dardo and Christian Laval, they're French, that is called The New World Reason. And the New World Reason, okay? I'm trying to translate. My French is poor. But what they say, that we've been facing from the 80s onwards with a new phase of capitalism, as I've already showed to you. Okay, my main argument, the whole problem of our debt has to do with the new phase of capitalism, there is something there's a structural problem. We're not going to solve just by electing someone who's going to be there and say, oh, okay, I'm not going to pay so much interest to that and that, okay, because it's a structural problem. That's something that I was saying that we've got to have another talk about this. We can talk this afterward, right? So let's come back to my point and finish. So this book by these two French philosophers, the main argument, they point out that we've got a kind of a new rationale, okay? A new reason that comes with the new liberal, right? And it's more than thinking that the problem is an economic, it's a political, is the problem of capitalism nowadays. So the monster of capitalism, which is growing worse and worse, and worse in our peripheral countries. In Brazil, we say there is a barbarian phase, which is different here, because here that we have cuts and privatization and market measures within the NHS in England, basically in England, right? But people here consider health as a social right. Let's say part of the people, right? They have this because they've built this. But in Brazil, we haven't actually built. We've just had written on our constitution. So with all this atmosphere, what these philosophers are saying to us, that the neoliberal times come with such a power that people are much more interested in buying, okay, in consuming. So health treating as a commodity. But in capitalism, everything is commodity. Right, I know that. But it's become more and more, everything is being transformed into commodities. I can talk this in another time. So my answer is, we've got to fight against capitalism. I'm really for Jeremy Corbyn in this country, because he's the only one who's been talking about socialism, right? But nothing to do with the Soviet Union. We're talking something different. We're talking about an anti-capitalist fight. And I want to finish with this. Thank you very much.
Yes. Should we meet, let's say, at 3:30 for the seminars?
That's your break, 15 minutes. And then also stop recording.